In this video, I am going to talk about the most common mistakes during JCC refinement. Number one mistake, starting with a wrong sphere. This happens when we have a patient with a large amount of cylindrical power and small amount of spherical power. Let's say for example, if we have a patient with a power of minus 0.50 diopter spherical with minus 2.50 diopter cylinder at 90 axis. In this situation, what we usually do, we usually rush to refine that 2.5 cylindrical and we fail to focus on this 0.5 spherical, and this spherical might need to be higher or lower. Since we didn't check that first, we are starting with the wrong sphere. This will lead to inaccurate results. So it is very important to optimize your sphere first, then go for a cylinder. The second mistake, too quick presentation. This means if you are flipping your JCC too fast, you are not giving an adequate time for your patient to compare your options. Let's say you just flipped very fast. What will happen? You didn't show them the first option properly. Your patient might say the current position is clear simply because that's what they are looking at right now. This is not a proper comparison. Remember, JCC is a fully patient responsive test. So always give them a proper time to differentiate the both options. And the third mistake, misalignment or improper orientation. We know for axis refinement, we keep the handle parallel to the cylinder axis in the trial frame. For power refinement, we keep the JCC axis parallel to the cylinder axis in the trial frame. This is very important. It should be on point. If you miss even a 5 degree, this will lead to improper results. So always handle your JCC with the proper alignment. And the fourth mistake, over refinement. This happens when you have a patient with a low cylindrical power like 0.5 or 0.75 diopter astigmatism. Let's say for example, if a patient have a 0.5 diopter at 90 axis, let's say you started refining the axis. Initially your patient said it is slightly better towards 80. So you just kept at 85 and refining it again. Now your patient saying it's slightly better towards 80 again. Now at 80 you are refining it again and your patient saying it's slightly better towards 85. In this situation, just stop your JCC and check your patient visual acuity. Our goal is to reach maximum visual acuity with comfort. You don't need to over refine again and again. Once you achieve the maximum vision with comfort, you can move on to the next one. And the fifth mistake, forgetting your sphere adjustment rule. Never forget to adjust your sphere when you change the cylinder 0.5 or more. It's very important to maintain your spherical equivalent. If you miss this step, your final prescription won't be accurate. So adjust the sphere by 0.25 for every 0.5 change you make in the cylinder. Sixth mistake, using the wrong JCC power. We commonly use plus or minus 0.25 diopter JCC. But this is not reliable when you have a patient with a vision of 6/12 or poor visual acuity. This 0.25 diopter won't give a noticeable difference for them to compare. In cases like these, consider using a 0.5 or 0.75 diopter JCC to get a reliable results. And the seventh mistake, not rechecking your axis after a large changes in the cylindrical power. If you change the cylinder 0.75 or more from your initial cylinder, you must re-verify the axis once again after your power refinement. This is very important because your patient visual acuity will be significantly different before and after power refinement. Let's say for example, you have a patient with a minus 1 diopter cylinder at 90 axis. Initially, when you are refining the axis, it was equal, and after power refinement, it turned into minus 2 diopter cylinder. Now, your patient seeing the vision chart with -2 diopter cylinder before they saw with -1. Now, your patient visual acuity is better to notice the axis differences much more clear than before. So, it's very important to reconfirm the axis after your power refinement. If you change more than 0.75. They might have a minor adjustment like 5-degree differences that might give them a better clarity. And the eighth mistake, assumption. In my personal opinion, assumption is always wrong in clinical. Never ever assume it, verify it, confirm it, never assume it. This mistake might happen when you have an option of going through all the previous glass prescription records and the current glasses whichever the patient is wearing. At the moment you look at the old cylindrical status, our mind will start assume things. And also, if we get the same amount in our retinoscopy, we'll just think like it's gonna be same. But that's totally wrong. You have to refine your current refraction. The patient might be wearing a wrong axis and adapting it for a long time. If you find that now, you will be the one giving them the proper corrective prescription with better clarity. So never assume it. So that's all about the common mistakes. If I have missed anything, you can tell that in the comment section. I'll see you in the next video.